Thanks, Caves.
Yeah, all good.
Mr. Salt,
thank you so much. Thank you so much, James and Kiva. Again, good morning and good afternoon. Welcome to this webinar on the Asia Pacific Challenge Facility Grantees discussion. So this webinar will be for the different Challenge Facility grantees all across Asia and also covering the Pacific region as well. And this afternoon we'll get to hear from the different grantees about your different projects and focus activities over the course of the next year, and see how we can collaborate and link each other's work. So again, a reminder, next slide please, so if you're not speaking, kindly mute your mic, camera on when speaking, and if possible, and if your broadband connection will allow. There will be Q&A in every end of session. So please hold on to your questions, and then we'll open the discussions in each end of the session. I'll show you later how the sessions are divided, unless you've already seen the agenda. You can raise your hand later so that I can acknowledge you before you can speak. And please be mindful of time as well. We've dedicated 3 minutes, not 3 hours, 3 minutes for each of the grantees to share a profile of your project, and then next slide. Again, the objectives of this webinar is to introduce the Challenge Facility for Civil Society Grant Mechanism, its coverage and intended outcomes for Asia Pacific, to share information with each other, and towards the end, identify possible areas of partnership among Challenge Facility grantees in the region. We won't do the introduction in the beginning, but what I'm gonna do is when I give the floor to your organization, then you can use the time to introduce yourselves, whoever is in the room. I confirmed that some of the organizations have more than 2 to 3 participants, which is really good. We have 31 in the room today, so that's a good turnout. So later, I'll give the floor to you when your organization presents to introduce yourselves and your peers as part of your presentation. So before we actually begin, just a quick walkthrough of the agenda. Again, I'm still hearing some people, so if you please mute your mic, thank you. So we'll have opening remarks and introductions from Stop TB Partnership, a quick presentation on the Challenge Facility, and also a presentation on ACHIE, or the Activist Coalition of TB Asia Pacific. Then after that, we'll go through the grantees introduction. So we divide it into 4 sessions. So the Insular Southeast Asia, which includes the Philippines and Indonesia. And then we'll go to MEKONG, which includes Myanmar and Cambodia. And then South Asia, which includes Pakistan and India. And then the regional and the global organizations that includes Apcaso, GCTA, and TB people. And then we'll open the floor for brainstorming on the next steps. All right, so without further ado, may I call on the Executive Director of Stop TB Partnership, Chika, to give us opening remarks. So Chika, over to you.
Hi, actually, so thank you so much, Jeff, and I'm really impressed. We are 32 here. This is really great. And I'm really honored to be able to be here, because I know very well that the ones doing the work and the ones, having a lot of things to worry about and to stress about and to deliver are you guys, being on the ground, being in the field, and having to really face a lot of the current challenges. Who would have believed that we are, in September almost, and we are still, to be honest, in this situation with COVID, that we don't know exactly where we will go and how. I'm very happy to see some of the friends that we know for so long time here, and you, Jeff, taking over the facilitating of this session, but as well I saw Blessy, I saw Chamroon, I saw the colleagues from Reach India, and I've seen others I will not mention, because then I will take over the introduction of everyone. So I will not I muted myself. So I will not go too long. I will just say two things. One is we are very happy with this amazing round of challenge facility. And we think that it will be an amazing work that will happen. And I want to say that as with all amazing work that is done, there are chances to have another round announced towards the end of the year. And that will be really very great to either consolidate your work or to go further. It will follow the same process, but it looks like we will be able to secure some additional funding to have towards the end of the year announcing a new round for challenge facility, which is really unprecedented in our, at least for us in Stop TB Partnership. And this was the first point. So, you know, great work done. We'll obviously secure further funding and so on. The second point that I wanted to make is this. You see, like we need to have in each countries, you know, the partners that are, you know, relevant and important coming together. And that's why the role of the challenge facility grantees will be very important in those platforms. So we will try to make sure that everybody is connected with the other challenge facility, if it happens to be there, with TB Reach grantees, with the Stop TB partnerships or any other platforms that are over there, with the USAID mission focal points, with obviously the TB program managers and any other civil society and community networks in case people are not aware. The ultimate dream is that we are able to create a very solid environment in the country to really generate demand for you know, the best tools and the best treatment for people, that generate demand that those that are affected for TB are the driving seat of the program for accountability. But as well, a very important piece, we want to make sure that everyone that is a grantee is having a potential, not the abilities and capacities to do advocacy as well. When I say advocacy is because of the UNHLM, everyone committed that by the end of 2023, we will reach certain targets. Among those things that were supposed to happen, it's also that the head of state or the government will be much more with the eyes on TB. Unfortunately, because of the COVID right now, there is no eye on TB, I would say, or it is some. It becomes to be more because we made a lot of noise, so we need to keep the pressure on that. But we need to make sure that the civil society and the challenge facility grantees will have this capacity. So there needs to be not only empowerment, but also knowledge. So there needs to be some ideas and trainings and so on about how the program is constructed, but also how to do proper advocacy to ensure that the heads of states and governments don't forget about TB. And one thing that we might need to think all together is how do we ensure that we are aware what's happening in the country, sort of like even like a hotline in which if somebody says, okay, what's happening in Cambodia, at least some headlines are known. Drugs are enough, diagnostics, people are really, you know, engaged, human rights respected, gender, all this inclusion, no stigma, discrimination, you know, and enough financing. What we will observe is that, and we see already in 1 or 2 countries, the governments will have a tendency to cut the TB budgets and to put into COVID. It's sometimes is not just cutting the TB budget, they will cut all other sectors except to put into COVID. But in some instances, we noted specifically cutting the TB budgets, which creates huge problems because obviously if you cut now in September the budget for 2021, everyone applied to Global Fund, made their plans with a certain budget. So we will need for you know, the challenge facility grantees as well to be a little bit aware of some of the dynamics in the countries as well, as much as possible, of course. And you know, depending on the scope of the work and so on, not like everyone will have to do everything there. So we are very excited and we will try to create like a network where all these emails and everything and connections are being all together in such a way that, you know, we are able to be in touch rapidly on what is going on and how and so on. So I think today will be it's a great opportunity for everyone to discuss. We are in time now, it's 10:15. So I will stop here. I will stay with you till 10:30. We have few other things going on. But I'm really, really happy that this is happening, and I'm really grateful that you all took the time to be in this discussion today, and you, Jeff, doing all the facilitation and so on. So thank you so much.
Thank you so much, Luchika. It's really nice what you said about the partnership, the knowledge, and the capacity building. And I think in this time of COVID, the challenge facility, the name itself really embodies the challenge for TB activists and people who and organizations who work on TB at least for the next 12 months. And really looking forward also to the next or the upcoming grant under the challenge facility. So thank you so much for that, and we look forward for that one. Okay, thank you so much again, Luchika. I'll go before this. Can you go back to the slide again? Thank you. I'll give the floor now to the Stop TB Partnership colleagues. Perhaps you'll do a presentation on the challenge facility. So maybe James, let me call on you, and then maybe you can introduce your peers. Thanks.
Thanks so much, Jeff. So, given the, I think we've already had a couple of different presentations to all of the grantees, both around like where we covered challenge facility generally. I just wanted to say a couple of comments, and then I'll also just call on my colleague Kiva to say a few things as well. So, firstly, I think echoing everything that Luchika has said, but also to note, we're heading into a year where we've got the follow-up meeting, I guess, to the high-level meeting on TB. And I think many of us were involved a couple of years ago around building quite a strong declaration that includes quite a lot of components around communities, rights, and gender, about overcoming barriers to access, around stigma and discrimination, around the involvement of key populations and people affected by TB throughout the TB response. And one of the amazing things about Challenge Facility, and one of the things which allows it to sort of stand apart from a lot of other funding mechanisms, is it funds these very sorts of activities. So they're things that I think that we all believe are critically important. But now, because of the high-level meeting and the political declaration, they're things that countries have also committed to realizing. So just to say that we're seeing Challenge Facility grow and grow, and I think that that's amazing, and acknowledge all the work of Luchika, but also our donors who have stepped up in this space, and particularly USAID and Global Fund. And we also want to see, I guess, more and more donors come to this. So being able to share the really wonderful efforts that are coming across through all of your grants will be particularly important. So my role at Stop TB, I think, is like I'm a focal point in the CRG team for many of you. And my colleague Kiva, who is also, I think, has Cambodia and Myanmar and Pakistan. So between the two of us, I think we cover a lot of the region. So very much looking forward to working with you on all of these. And just to add, I suppose, introduce two other team members, and that they're away at the moment, so they're not able to join. But we have a colleague whose name is Dr. Srinivas, and he's a technical advisor for Asia. So if at any point you need support around some of the technical aspects of TB, and also engagement with sort of decision makers, we have people in our team who can support with that. And secondly, our colleague Enrica, who leads on Stop TB partnerships. So Stop TB is obviously based in Geneva at the global level, but we have an increasing presence at country level through national Stop TB partnerships. And I think one of the grantees for Challenge Facility is Stop TB Partnership Indonesia. So they're a wonderful example of this. But just to note that in several of your countries, including Pakistan, including Philippines, there are national Stop TB partnerships which have different shapes that are really good, resource for you to tap into and engage over the course of your time. So if you want to learn more about that, we encourage you to reach out and to our colleague Enrica. So noting that there's a very full agenda today, I'll hand over to Kiva very, very quickly, and then back to you, Jeff. So over to you, Keith. Thanks, Jeff.
Good afternoon, everybody. It's a pleasure, absolute pleasure being with you all here this morning and this afternoon. As James mentioned, my role in the region will be to support those of you working in Myanmar, Pakistan, and Cambodia. So really looking forward to that. And then just one really quick point is on the work that the regional and the global networks are doing. What I think is really exciting now with Challenge Facility is that this is the very first time that we're able to support regional and global networks. So I'm really excited to see how the work that's happening and going on at national level is going to be supported by and done in collaboration with ACHIE and others, and Blessy, and at the global level with TB people as well. So over to you, and thank you very much for allowing me to participate today.
Thank you so much, Kiva. So as Kiva mentioned, Apcaso is also one of the grantees of the Challenge Facility in partnership with the Activist Coalition of TB Asia Pacific. You'll get to know more about our grant later on. But for now, let me introduce Chamroon, one of the co-chairs of the Activist Coalition of on TB Asia Pacific, to introduce what ACHIE is, who are the members, and what the ACHIE is currently doing. So, Chamroon.
Hi everyone, thank you very much, Jeff, and it is a great honor to be part of the discussion, and finally we have this kind of session together. And take this opportunity, like Jeff said, I would like to introduce the ACHIE, which currently hosted by the Apcaso. ACHIE stand for Activist Coalition on TB Asia Pacific, and it is the first regional coalition of TB activists, as you can see in this particular brochure. And it was emerged from a regional TB activist meeting that led by Apcaso and the Global Coalition of TB Activists, GCTA, in November 2016 in Bangkok, Thailand. And the meeting was made possible with support from the Global Fund External Relations Division, the Global Fund Community Rights and Gender Special Initiative, CIGSI, Open Society Foundation, OSF, and the Asia Pacific Community Rights and Gender Platform. Our platform, we come up with 5 different commitments, as you can see from there. We call ACHIE commitment to action. We will act to give TB the political attention it deserves. We will act to present an alternative model to the pervading biomedical approach to TB. We will act to overcome barriers to TB treatment and diagnostic access. We will act towards securing adequate strategic investment for TB, making sure that this investment go to the right intervention, including by community. We will act to support a coordinated and capacitated TB community and activist movement. So these are the strong 5 commitments to action that we come up as part of our platform, addressing and try to move TB program to ensure that it responds to the need. And actually, we are working for effective, people-centered, right-based, and sufficiently and strategically resourced to be respond. Currently, there are 14 countries where ACHIE support and work with. This including Cambodia, China, India, Indonesia, Laos, PDR, Kiribati, Malaysia, Mongolia, Myanmar, Pakistan, Papua New Guinea, Philippines, Thailand, and Vietnam. And most of this country is also benefiting from this challenge facility for civil society grant. And thanks to the Stop TB Partnership for the support to this country, so that we can move forward of how can we strengthen the CIG role in TB response. This is just only a snapshot of what ACHIE have done so far since the platform established in 2016. So first, in-country mobilization around UN high-level meeting on TB in 2018. This include letter writing for country mission, speaking in mission, visit in New York, and releasing regional community and civil society statement. Development of a regional human rights and TB module with an aim to build the capacity of TB survival and affected community to document experiences of human rights violation and advocate for a more effective right-based country response to TB. Coordination and technical assistance support to 7 countries and Western Pacific region to incorporate plan in increasing engagement of national TB program with TB survival and TB affected community. And last but not least, promotion and increase visibility of ACHIE, its membership, and its work in various platforms and meetings both regionally and globally. So thanks once again, Jeff, and thanks to this session that allow ACHIE to share who we are, what we do, where we focus, and what result, what activity we have done so far, and hope through this session we can better connect and we can better strengthen our regional collaboration to ensure that CIG
Shamroon? I think we lost you.
I think we lost him.
Yeah. All right. Okay. Let's hope Shamroon is back for the presentation later. But thank you again, Shamroon, one of our co-chairs from ACHIE. And I also wanted to take this opportunity to say that the ACHIE is also being hosted currently by Apcaso as the regional network. And Shamroon is only one of the 31 members of the network of the coalition spread out in the countries that you see on the screen. But I also wanted to take this opportunity that if you want to join ACHIE, please do let me know. We use the platform to share information and also collaborate with each other and strategize with each other in some of the regional and global advocacy spaces as well. So I look forward to your participation and membership as part of ACHIE. You can just send me an email anytime and we can make you part of this wonderful regional coalition. We'll get to know also some of the ACHIE members later on, so watch out for that as well. All right, so having done the opening part of our program, let's now proceed with the 4 sessions of the presentation. Really excited to listen to each of your presentations this afternoon. So we'll start with the Southeast Asia session. It's also good to see that we're 3 minutes early, which is good. Okay, I feel good today. All right, so we'll start with Southeast Asia, and the first one that we'll present would be Action for Health Initiatives from the Philippines. So anyone from ACHIE? And then please don't forget to introduce your members as well who are in the call, and then you can proceed with your presentation. So I see Mara. Mara, go ahead.
Yeah, thank you, Jeff. Mara Quesada here. I'm the Executive Director of Action for Health Initiatives, or ACHIE. My colleague, Junlin Tabelin, is also on the call. So 3 minutes, Jeff. Okay.
Yes.
Well, so ACHIE has had a long history of working on evidence-based advocacy anchored on human rights and meaningful community engagement. So largely our work is around HIV and AIDS, but we've moved on TB. We've moved on to working on TB in 2017. And thanks to Stop TB Partnership, actually, because one of our first major grants to work on TB was from the Challenge Facility for Civil Society. So our current grant actually builds on our previous CFCS project, but it also responds to a demand from the TB community in terms of building their own organization that will be focusing on advocacy. As you probably know, many of the organizations of people affected by TB in the Philippines are organized by treatment facilities. So they're organized by nurses or organized by doctors to be patient support groups. So there's a core group of people from the community who approached ACHIE and wanted some support in terms of helping them build their own organization that will do more than just supporting each other, will be engaged more proactively in the TB response through advocacy. So that's what we're going to do. We're going to do for this project with the vision of eventually ensuring that they become legally registered in the country, primarily so they can be sustainable, meaning after the project, they'll be able to also access funding on their own. One of the focus application of this community organization will be their engagement in the current amendment process that's happening with the Philippine TB law, primarily in terms of pushing it in the Senate because it has already been approved in the House of Representatives. So that is like a test for this new organization, their engagement in in lobbying for the amendment of the TB law to ensure community engagement in the TB response, to ensure responses for for TB-related stigma and discrimination, and making sure that voices of the communities are heard in various levels of decision-making and structures related to the TB response in the country. A small part of the project that's also been attached to our CFCS is finalizing and packaging our CRG assessment report. This was an endeavor that was separately funded as well by SUB-TB Partnership in the previous year. So we're putting this together into something that can be disseminated to partners and hopefully also lead to the development of a more comprehensive national operational plan for TB that focuses on communities' rights and gender. Thank you.
Oh, thank you so much, Mara. I was about to start my timer on the 1 minute, but you did it well. Thank you so much for that. Thank you for the brief profile, really very clear. Okay, moving on to the next one. Again, just a quick reminder, if you have any questions or clarifications on any of the projects, a comment about the potential partnership would be wonderful as well. Please do so, but we'll go to the Q&A later on after each of the session. So hold on to your questions and comments, and then we'll open the floor. Next up, we have innovations for community health. And who will present from innovations? I see Joy. Joy, go ahead.
Good day, everyone. I hope you're all doing well. I am Joy Flores, and I'm with Ms. Rachel Basas, our Grants Management Lead. It is with great pleasure to introduce to you our organization, Innovations for Community Health. So Innovation CH, or ICH, is a not-for-profit public health implementation NGO based in the Philippines. And even though we are a relatively small and young organization, only established last 2019, we envision to reform health markets and systems by delivering high impact and sustainable innovations at scale. We are also known for being one of the first public health NGOs in the country to employ a social enterprise model as a sustainability tool for our projects. At present, we are managing 3 projects focusing on TB and 1 on hypertension, all possible through the collaborative effort of our dedicated staffs and leads. So, under the CFCS grant, we will be implementing the Engage TB project. So the long name is Empowering the Next Generation of Advocacy and Grassroots Engagement for Tuberculosis. The objective of this project is to ensure that quality TB care is available, accessible, and acceptable for Filipinos affected by TB. We hypothesize that this could be achieved by having empowered communities who are proactively reporting the barriers of care that is preventing them from being diagnosed, treated, and reported. So for this project, we will be rolling out a localized version of the One Impact digital platform, accompanied by implementation research to assess its impact to the population of healthcare workers and people affected by TB coming from different types of TB dots facilities within Metro Manila. And we are currently in close coordination with the National Tuberculosis Program of the Philippines, who has already expressed their interest and support to this project. And hopefully we could further expand our connections to include more TB project implementers, community-based organizations, as well as support and advocacy groups. Just to provide a quick background about the One Impact digital platform. So this is a digital health solution platform, also endorsed by the SUB-TB Partnership, developed for people and communities affected by tuberculosis. So through its modules, the person can access knowledge and references about TB as a disease, as well as information on the nearest TB service providers within their area. The app also has the capability to link people with other persons affected by TB through peer-to-peer support and to connect them with healthcare workers and stakeholders to whom they could report the challenges or issues they are facing with their TB care, all throughout a single mobile application. So Engage TB is our organization's innovative and whole of systems response to ensure that we are promoting inclusive, evidence-informed, and community-initiated advocacy and reforms for TB care. So that's all for Engage TB and ICH. Thank you.
Thank you so much, Joy, and thank you to ICH for that brief profile. All right. Moving on, we have Stop TB Partnership Indonesia and Pop TB. And from this group, the one that will present would be, please turn on your mic so that I can acknowledge you.
Hi,
Thea?
it's me.
Yeah.
Yeah. Yes.
And please
Thank
also
you.
introduce your team members as well. Thank you.
Yep. So, hi everyone. I'm Thea from Stop TB Partnership Indonesia. So, for the Challenge Facility and Civil Society grant, we work together with Pop TB. So, it means like Indonesian TB Patient Network. So, I think Iman is here with me. Can you show your face or with your colleagues? Iman?
Yes. Yeah. Hello,
Oh, yeah.
everyone.
Yeah, he is.
Yeah.
Yeah. And also with Lukman, Mr. Lukman from Stop TB Partnership Indonesia. He's my colleague from STPI. They're both here and they will stay throughout the sessions. I'm really sorry. I'm just gonna present and I have to leave for a different meeting. So I'm gonna start presenting. So our project, it's called Affected Communities Empowerment to End TB. And we do this with Pop TB. Like we had some ideas together a few months before the grant was announced, because we know that Pop TB wants to contribute in TB elimination for 2030, and they want to show that community empowerment and meaningful participation of TB affected communities can add value to the country's efforts to eliminate TB. So since the focus is actually on Pop TB, it's reflected in how the grant is requested, and which like only less than 15% of the grant is actually goes to STPI to do very few activities. Most of them would be conducted by our colleagues from Pop TB. So the objectives of this grant for us, first is to increase community and civil society leadership and participation in the country's TB response, including from like prioritizing on the important aspects of the program and then designing interventions, also to implement, monitor, and evaluate TB services. And second is to strengthen community advocacy at the national and subnational level, specifically to key stakeholders and decision makers who are involved in community rights and gender. So we will be involving media groups and also community legal aid organizations and also parliamentarians throughout the project. For this project, there are about 8 main interventions. So first is to Pop TB will lead this part as well. They will strengthen their strategic management, including like formal partnerships with the MOH and also partnerships with our colleagues from the HIV communities and also with media groups and community legal aids. And then with these partners, we will support Pop TB to improve literacy about human rights and gender equity. And their network spans into 12 provinces across Indonesia, and most of them are now involved as peer supporters or peer educators. You may have met some of them already when you go to union conferences like Ani, and then there's Paran and also Pak Budi, the head of the Pop TB network, who's unable to join us today, unfortunately. And also, after trainings for the Pop TB network members, they want to do like a small group meetings in the PMDT hospitals to disseminate more information about TB and also why human rights and gender are actually linked or inherent to the TB response, to increase this literacy not only to the Pop TB networks but also to their communities, the current patients. And also Pop TB is currently collaborating with LKNU to do the One Impact application development, currently utilizing the grants from Global Fund, but it was initially, the pilot was through the support of SUBTB partnership. And one of the things that PopTV would like to explore later on is also about mental health side effects. And other things would be for PopTV social media and website publications of their activities, but also information about human rights and gender perspectives. And for us in Stop TB Partnership Indonesia, we want to improve the role of civil societies, especially TB patient communities and TB survivors, about public accountability for district TB programming and implementation. So more like budgeting and setting priorities in the districts in which PopTB networks are spread. And also for them to engage with parliamentarians at the district levels. And also, lastly, through this grant, PopTB will also initiate connections with stakeholders at the national level, but also regional and global level. Yeah. So that's why Iman will be here throughout to the end of the session, and I'm sure that you guys can definitely talk more with them about the interventions and objectives. Yeah.
Thank you so much, Thea and Iman and the rest of the team from Stop TB and Partnership in Indonesia and also PopTV. All right. We're now opening the floor for questions or comments. We have around 5 minutes. But also, at the same time, a quick reminder again, with regards to the time allotment for each of the presenters. I wonder if you heard the timer earlier. So I'm gonna start the time as soon as you start presenting as well, apart from the introduction. So be mindful of the time as well. Anyway, thank you so much for that presentation. All right, so any questions or comments from the rest of the people in the room? I see Kiva's mic is on. Kiva, do you have anything to raise?
Just one really quick thing for those of you, because I think there's maybe 2 or 3 of you that are doing the One Impact project. Just to let you know 2 things. Number 1, we're upgrading the platform based on the learnings from the initial pilot countries. So you will automatically benefit from that. And James will be in touch with you with details on that. Second of all, there's an implementation handbook which really supports countries through that entire process of going through all the different implementation phases, from the feasibility and needs assessment to the monitoring and evaluation. So we will definitely share that with you as well if you do not have those materials. So just to let those of you know who are doing this work so that you're aware of that. Thank you, Jeff.
Thank you so much, Kiva. And that also reminds me that with regards to the presentation that you're seeing on the screen, we'll be sending it out to everyone as well, so that all of you can have a look back and see what the others have been doing as well. So again, any questions or comments? Or forever hold your peace for now? Being none, all right, I think we're good to go to the next session. But then again, if you have anything to raise from the previous session, please free to do so. We've allocated a lot of time with the Q&A, so let's take advantage of that as well. Moving on, we'll go to the Mekong sub-region, and we'll start with Alliance Myanmar. I see Ong from the Alliance. Ong, please go ahead, introduce your team as well, and then go ahead with your presentation.
Hello, can you hear me?
Yes.
Yeah, I'm Ong, and I'm here at the Alliance Myanmar office, and I'm together with our executive director, Dr. Sonai here. Hello. He is also too. So let me introduce about our organization first. So we are Alliance Myanmar. So previously, we start with the country office of International HIV/AIDS Alliance. So we changed to a local organization in 2018. So up to now, we quite focusing on the HIV treatment and prevention part. So with the for key population, with the support of the community-based organization and community-based network. So this project, this CFCS project would be the first TV project in our for our organization. So this project, we plan to conduct the CRG assessment with the full collaboration from the National TV Program. So we have quite a brief meeting with the program director from the disease control. So he's quite interested in this assessment and everything. So we plan to do this assessment in at least 3 sites, 3 townships in Myanmar. And also we also plan to get on board the community part as well, because we like to form the kind of a TV survivor groups in these townships, and then we will also work with HIV community-based organization, so how they can help for the data collection and so on for the CRG assessment. And also what I'm quite interested in is that after this CFCS projects, how we should continue the community parts for their work on the support for the TB diagnosis and treatment, and also for the advocacy as well. So these are the quite brief introduction of our upcoming CFCS project. Thank you.
And we are new in this TV project, apart from our previous activities for TV HIV integrated work. So I think you all understand what is CRG, right? And maybe if we need to explain a little bit more what is CRG, maybe Dr. Ong Ziapang can explain to other members, or I don't think it is needed, right? Because every country has done it. Thank you.
Thank you so much, and nice to see you both. Yeah, definitely. And I think this platform and the partnerships that will be formed through the Challenge Facility all across the Asia Pacific can really help you to learn more, and also to see how else can you implement your project in Myanmar. And we're also very happy from Apcaso and ACHIE to help out as well. So really looking forward to the collaboration with Alliance for this challenge facility. Thank you so much.
Okay, Taro is the one who introduced us to that business.
Sorry, say it again.
Oh, I just say hi to Chamaron because he's the one who connected us. Yeah.
And speaking of Shamroon, next would be Kana to present their challenge facility. So thank you again. So from Kana, who will be presenting? Please turn on your mic so that I can acknowledge. Shamroon or Chantorn?
Chantorn.
Okay.
Okay, thank you, Bang Gran. Okay, hello, good afternoon, everyone. My name is Chantorn. I am partnership and networking coordinator of Kanas. I'm also a project lead for CSCA 2020 or around 9. So, okay, thank you so much for having this such great session. Just want to give you the briefly about our Kana and also the connection between Kana and also the Stop TB partnership. So as you can see that Kana is a key partner of the Frontline Aid, like Alliance as well, formerly known as the International Aid Alliance, and the largest national NGO providing HIV disease care support, at community level. So it's mean we work directly with our community. And also we also focus on the integrated sexual and reproductive health, family planning, maternal and child health, as well as TB, tuberculosis, and livelihood program. And currently we across our program, we also focus on community rights and genders. So you, at the right hand side, you can see the connection and also what the Stop TB partnership has brought to Kana so far. So Kana, we are formally grantee of the TB Reach Wave 5 and also moving to TB Reach Scale Up. And then from 2017, I remember we were grantee of CSCF round 7, and last year round 8, and right now we are also being a grantee of CSCF round 9. In another hand, we also got country partner to implement KP assessments, gender assessment, and also CRG, accountability action framework as well. Next slide, please. So going straight to next one, to challenge facility around 9. So our project it's called INTB. So it stands for empowering networks to demand for TB services. So in short, we can say NTBs. Yeah. So we have 6 objective or interventions under this CSCS round 9. So objective number 1 is to build a strategic partnership for a stronger national CRG response. So under this objective, you can see 3 intervention or activity. One is to introduce CRG to our national TB program, civil society partners who working on TB and also HIV and TB, and also affected community by TB or TB network. And second one, we introduced the TB stigma assessment to the national TB program and also CSO partners. And number 3, we also introduce or build, our CSO partner and also CSO on the declaration of the rise of people affected by TB among NTP, CSO, and TB community. For objective number 2, this is to introduce community-led monitoring using one impacts in for operational health district. So this is like in this particular objective, we are expanding our one impact implementation to other for operational health districts. It's like a complementary to our ongoing USAID funded commit projects. So you can see one activity is for one impact expansion, and another one we also the result from the one impact implementation, we collect the data and also how the data can be used. Next slide, please. So for objective number 3, it's about the financial barrier, address the financial barrier to access TB services. So in this particular objective, there are two main activities. One is income generation for people living with and experience TB. We are partnering with Reach 52, which is the expert company providing capacity building on financial management. And also we build capacity of our TB network and affected community on economic empowerment as well. For the objective number 4, to support the use of CLM, community-led monitoring data for community action and advocacy. So here the result or data collected from one impacts, we will host a number of meeting or coordination or partnership meeting with our provincial health department, operational health district or health center, how the data can be analyzed and also used, and how it could be made for the change. Next one. And activity number 5, strengthen the capacity of district TB community network. So here we plan to establish not plan. We will have to facilitate in establishing of other 4 network at district level. That's called district network of people living with and experience TB. Learning from our experience on last CSCA grant in Siem Reap province, we already supported to establish one DNPAT district network. So that's why we expand our effort, our initiative to other sides. So, and then those network will be trained or will be strengthened on TB and human rights. This also thanks to Jeff and also ACHIE as well. For the last year, you know, you introduced, it's like how to say, a pilot or testing TB and human rights training manual in Cambodia, and now look and how see and how we can implement or expand, you know, this training to other side as well. And another one is about learning and sharing, and also thanks to ACHIE again. Last year, last CSS grant, we also received the support from ACHIE by having a co-chair of ACHIE, you know, to share the CRG work regional and to country how we can move forward. And the last one is objective number 6 is build the institutional capacity of the 4 district network. So it's mean when we support to establish, and also we need to strengthen how those network can be, you know, function, also strengthen. Can you go next one?
I think that's the.
Yeah. Maybe okay. You lost something. Maybe I can say only two points. One is leadership and management for the network, leader of district networks, and also another one is to promote meaningful engagement in TB response. This is what we are going to do under CSCS right now. Thank you,
Thank
Jeff.
you so much. Thank you so much, Chantorn, for that comprehensive presentation. All right, so it's now time for Q&A, focusing on the presentation from Alliance and also CANA. And if you also have any comments or questions from the previous set of presenters, please raise your hand so that I can acknowledge you. Unless you're already excited for your time to present. Going once, twice. All right, being none, let's move on to South Asia. So South Asia will start with APL-HIV, and for APL-HIV, we will have, who's going to present for APL-HIV? Is it Askar? Zaya? Please turn on your mic so that I can acknowledge you.
Jeff, I will be presenting. Askar.
Okay. Thank you so much, Asgar. Please go ahead. And please also be mindful of the time. I hope you don't find it offensive if you start hearing the sound from the background. That means your time is up already. So thank you so much. Go ahead.
Okay, thank you very much. I am Askar Sati. Most of you know me. I am from Pakistan, National Coordinator of APL-HIV, and I am joined with the project coordinator of this particular CFCS project, Uzair. So, Jeff, basically today, you know, I am much more in a hurry than yourself, so I would be very brief because I have to leave for, you know, registration of 2 of the networks, and myself and Uzair, we have got an interview there, so we have to reach there. So thank you very much for giving the, you know, opportunity. So first of all, you know, very quick profile of the organization. The Association of People Living with HIV is the national network of HIV community and associated key population. It was established in 2002 and formally registered in 2008. And since then, we have been working with the HIV community and key population. And based on our work, basically, then, you know, we were requested and we were approached by the TB program and other partners to, you know, maybe if we can utilize our expertise in the TB, you know, response as well. So mainly the strategic direction under which we, you know, perform our work, that is research, advocacy, community-based monitoring, empowerment of communities, and system strengthening. Currently, including the Global Fund country level project, we are engaged in 7 different, you know, projects at the community level. And we are working across Pakistan with 1 office at the federal level and 4 offices in 4 respective, you know, provinces. So coming on to this, you know, CFCS Round 9 project, basically we have 3 objectives under this project. Number 1 is strengthen TB community engagement and activism at grassroots level in Pakistan. Just to give you a background that in Pakistan, TB activism that is almost non-existent, and this was identified in one of the CRG studies that we conducted in Pakistan with support from Stop TB Partnership, and based on the recommendation of that study, basically we thought that we should work at the grassroots level to mobilize the TB community and associated key population. So for that, we have a couple of activities. That is, number one, we will be establishing 5 community support groups at the community level, followed by development and translation of the TORs, the roles and responsibilities of these the community support groups, and then followed by training of these community support groups on their roles and responsibilities as per approved TORs. Then apart from that, as a whole, we also need to capacitate the TB community and identified prioritized key populations relevant to TB. And for that, we will be developing 6 different training modules, which are basically the basics for mobilization of the community at grassroots level. So that includes a training module on human and health rights, combating TB-related stigma and discrimination, communication skills, leadership skills, advocacy skills, and then the translation of the Global Fund CRG guidelines, and followed by 2 training sessions of 3 days each for these community people on these 6 training modules. The objective 2 is strengthen CRG in national TB response in Pakistan. So under this, we have a couple of activities that includes that we have to disseminate at the national level the CRG assessment report that was conducted last year. Then we have to develop, based on the recommendation of CRG study, kind of community mobilization strategy. And we have also to develop national CRG costed action plan. And during this dissemination workshop, we also look forward to have approval and endorsement of these 2 documents during this workshop. And then under third objective is to strengthen the engagement of TB community in response. And in that, let me tell you that probably in South Asia, Pakistan is the only country where we are implementing very effectively the community-based monitoring for HIV response. So we, on a limited scale, under this project, we also, plan to replicate the same in the TB response. And for that, we will be, launching and establishing and launching a complaint management mechanism cell, which will start functioning with effect from 1st January. And, we will be encouraging the TB community and the associated key populations to, seek the services from this complaint management mechanism to seek the solution to their issues and problems. So that's what the entire project is basically. Thank you.
Thank you so much, Asghar, right on time. And I hope you don't mind also introducing your colleague. I see Uzair in the room as well.
Uzair.
Uzair?
I think you're on mute, Asghar.
Yeah, hi.
Maybe just very quickly introduce yourself also.
Yes, Jeff, I'm working as a project coordinator for this grant, CFCS. Yeah.
Thank you so much.
So
All right.
I was a little bit busy with some other work. So that's why I asked Asghar to present the details for the project.
Totally understand. And thank you for presenting it. I know that you're on a run as well for another meeting, but thank you so much for joining us this afternoon.
Thanks to you. Thanks to you.
Thank you so much.
Thank you, Jeff.
Thank you.
Take care.
All right. If you have any, since APD-HIV will have to leave soon, maybe perhaps I can entertain just one question before you run from Timur.
Yeah, sure.
Maybe just very quickly, Timur, go ahead.
Yes, it will be a very quick question, like 20 minutes, no more. Hi, everyone. And guys, thank you for your presentation. I was actually wondering, based on what you were saying, there is clearly some connection between what you guys doing in Pakistan and what priorities of TB people are in our grant. And I was wondering if you guys would be interested to also collaborate in terms of strengthening capacity in terms of advocacy and promoting engagement, not just in service delivery, in fighting stigma and discrimination, but also in getting engaged in country level processes. If you would be interested, I mean, it would be really good to link maybe after the webinar. So it's not really the question, it's more like a suggestion to collaborate more. And here is my appreciation for the organization of this webinar, because I think it's really a perfect opportunity to think about this kind of linkages. We have in our challenge facility grant a bit of money, so we could basically support what you guys are doing with your funding, and think about boosting it a little bit so that we can both achieve more and promote engagement of the community in Pakistan. Thank you, over.
Thank you so much, Timur. Maybe any response from Asghar or Uzair?
Yeah, sure. Yeah, Timur, thank you so very much. And definitely we believe in close collaboration and partnership, and definitely we would love to, benefit from your experience, and I can get in touch, and we can always, seek support and guidance from you as well for better, implementation of project. Thank you so very much. I would be happy.
Thank you. That's a really favorable response, and I think in that alone essentially is the purpose. One of the purpose of this webinar today, to establish those linkages between organizations. So thank you once again.
And Jeff, you are really great in developing such linkages. Hands up for Apcaso.
Thank you. Thank you, Asghar. Thank you so much for that. All right, moving, unless there are any other questions for Asghar before they leave? Being none, okay, let's move on. Do we have Association for Social Development in the room? Can you please turn on your mic so that I can acknowledge you? Being none, just to double check James, because they didn't.
I was just going to say, maybe Kiva can reach out to them and just to see if they're able to join in a moment, and we can come back to them. Kiva,
Sure thing. Sure, let me do that.
Thank you so much, James and Kiva. All right. Since we don't have the Association for Social Development for now, let's move to the next one. So going from Pakistan, now going to India, the first would be Reach. And the wonderful person would be Anupama. So please introduce your group and then go ahead with your presentation. Thank you.
Thanks so much, Jeff, and thanks to Stop TB Partnership and Apcaso for bringing us all together. I'm joined on this call by Dr. Ramya Ananthakrishnan, Director of Reach, and Ms. Smriti Kumar, Director, Strategic Partnerships. And I'm Anupama. I'm Assistant Director at Reach. And I promise to be very, very quick. Next slide, please. So very quickly, for those of you who don't know us, we are 21 years old as an organization. We're based in Chennai in South India, and we've been working on TB since our inception in '99, covering a whole range of work, including partnering with the private sector, advocacy, providing care and support to people with TB, and of course, strengthening communities and working closely with the media. We also had the opportunity to undertake the CRG assessments in India with support from Stop TB in 2018. So a lot of what we proposed are learnings from that process as well. Next slide, please. So most recently, between 2016 and 19, with support from USAID, we had the opportunity to identify, engage, and build the capacity of TB survivors across the country in 6 states. And we've been working very closely with this group, whom we call TB champions in India. And through this process, we were able to, first of all, develop and put in place a mechanism by which survivors could be trained as champions, which has since been adopted by the program, including a curriculum for training TB champions. I'm not going to get into the details of these results. I just want to add that as a result of this engagement of TB champions, we were able to facilitate the formation of 7 survivor-led networks, 1 at the national level, touched by TB, and 1 each in 6 priority states, including TB Mukt Vahini in the state of Bihar in eastern India. Next slide, please. So this is what our CFCS proposal actually looks at. We are going to continue building on our work with TB Mukt Vahini in Bihar, which was formed in 2017 and with 13 trained TB champions, and has now grown to more than 250 members across the state, and became one of the first legally registered survivor-led networks in the country. So over the next 10 months through the CFCS project, we want to support the network to become, like other colleagues have mentioned earlier, to become more independent, to be sustainable post-project period, and also look at learnings in terms of what is this relationship between the network, people affected by TB, and the TB program. How do all of these different groups work together and develop these equations, never losing sight of the fact that the ultimate responsibility of the network is to people affected by TB. So our objectives through the CFCS grant are, first of all, to strengthen the capacity, as I mentioned. Secondly, what we want to do is, again, building on learnings from the Call to Action project. We want, where several TB champions have already been informally providing emotional support and psychosocial support to people with TB. We want to use their learnings, get their inputs, and in a collaborative manner, led by the TB champions of TB Mukt Vahini, develop a sustainable mechanism of peer counseling that we propose to test in a few selected districts of Bihar through this project. So this is, in a sense, at the core of what we hope to do, because this will also involve working with the program to look at facility-based counseling and so on. We're also going to support the network to advocate for involvement of local elected representatives. And finally, what we want to do is to try and strengthen the evidence base around the engagement of communities. This is something that's growing world over, as seen from all the presentations today. So how can we contribute to the evidence so that we can all make evidence-based decisions in terms of what's working and learn from things that aren't working moving forward? So we'll be bringing in both the Stop TB Partnership Stigma Assessment Tool as well as other measurements to contribute to this evidence base. I think I'm done, Jeff. Thank you so much, and happy to take any questions later. Jeff,
thank you so much, Anupama. And thank you, quick and clear. That's really, I really appreciate your presentation. All right. Is it okay for everybody if we fly back to Pakistan before moving to the next presenter in India? Let's fly back to Pakistan. I think Habib is from the Association for Social Development is already with us today. So let me call on Habib. I wonder if you can maybe say something about your organization and what your project would be about under the Challenge Facility. Please go ahead. Introduce yourself, and if you have any other peers or colleagues in the room, please do so. Introduce them.
Jeff, thank you for the opportunity. Sorry I'm late. Actually, there's a bad rain going on in Islamabad and the roads were jammed, and you know how it is. So I just got to the office and just started the call. So I apologize for being late. First of all, hello to everyone who's here. My name is Habib, and I represent Association for Social Development. We are one of the oldest players in TB in Pakistan, and we are a grantee of this round of CFCS grant. I am the project manager for this project that we are calling TB Survivor Engagement. So in this round, what we're trying to do is we're trying to link the TB survivors, people who have survived TB, with the undergoing TB patients through under-treatment TB patients through the application that is One Impact. Along with that, we're also making a forum of TB patients, a representation of TB survivors who will represent the ongoing patients, the under-treatment patients on the RHC level and then on the provincial level. So we're trying to bridge the gap between the care provider and the client being the TB patients, the under-treatment TB patients. So that's what we are trying to do. Presently, our project is in the intervention development phase. We're trying to lay the foundation of the project. We're trying to make guidelines and all. And hopefully, if things go right, we will be going to the field early next month. So right now, what we are doing is we have decided on the province. We have the district, the province. We've selected the facilities and all, and now we are just trying to make adapting the presentations of how we will present One Impact to our provincial TB team and the district teams. And also we will learn from all of the amazing people here who have been doing the community engagement thing for so long. This is so we have been a part of the PPM initiative in Pakistan for quite some time. We've also been a part of the MDR treatment in Pakistan, but the community engagement is something that we are slightly new to. So we'll definitely learn from all the amazing colleagues working with us.
Thank you so much, Habib. Thank you for giving us that very quick overview. Your project will be in Pakistan, and you're already part of that email listserv. So definitely please make use of this opportunity to link with other CFCS grantees as well. And we will definitely make the recording and also the presentations available for you should you need those future connections for your CFCS grant. So thank you so much for that. And apologies for putting you immediately on the spot after you just linked in. So, but I hope you can stay for the rest of the meeting.
That's okay. Absolutely. Yes, I'm here. Yes, I'm here.
Okay. Thank you so much, Habib.
You're welcome.
All right. So, I mean, since we all cannot fly anywhere, most of us at least, so from Pakistan, let's gonna fly back again to India. And we have Saati to present their CSCF grantee. And it's gonna be Amma. All right, please do introduce yourself and your team, and you can go ahead with your presentation. Thank you.
Yeah, thank you very much for this opportunity, and it's great to meet everyone. I'm Ramakrishnan, and my colleague Dr. Satish is here with me. I will make the presentation, and then he'll come in also for the Q&A if needed. So this is our first time getting a TB project to in this kind of framework. Previously, we worked on pediatric TB, and particularly in getting the private sector involved in diagnosis and treatment to care. We've also done a lot of work with key populations in the context of HIV, as well as in the context of social protection, access to name and gender change for trans people. We've been part of the decriminalization efforts in India, etc. So in this particular project, we are looking to work with transgender, specifically trans feminine communities. We have both supply side and demand side interventions. Overall, as far as the community is concerned, we'll be working with a community organization called Sahodran in Chennai, India. And we'll be working in Chennai, in southern India, and some neighboring districts. And the whole idea is to strengthen community capacity to provide community-led TB-focused advocacy. We've worked with the same organization before around advocacy in the HIV/AIDS context, as well as advocacy in the context of making feminization surgeries and hormone therapy available for trans communities, and sensitize providers for that as well. So we're trying to bring that experience into TB, work with the community on community-led advocacy for TB, and also making sure that we create a pool of community-friendly, trans-affirming providers who will provide stigma-free, affordable, and accessible diagnosis to treatment. Okay, so the target audience are, we have working with a couple of communities. Many of you would have heard of the Hijra or Kinnar community, which is the traditional indigenous trans feminine groups that live together in groups called Jamaats or Deras. But apart from that, there are trans folks who don't necessarily identify with the Hijra community, whose identity may be that of woman rather than that of third gender. So we'll be also working with that community. And so it's basically Sati and Sahodran. Our key activities with the community, we will do a baseline that also includes the CRG assessment and a detailed knowledge, attitude, practices in terms of health-seeking behavior, etc. And then we will be reaching out to 2,500 trans feminine community members, both Hijras as well as Kotis and other trans women, to do health literacy around TB. And given the current context, we will also combine it with some health literacy around COVID and necessary referrals where needed. We will establish referrals and linkages to TB services after doing one-on-one and one-to group sensitization of healthcare providers, both in the public and private sector. We hope to be developing TB champions on the lines of what REACH has done with several communities, but specifically from the trans community. We gather that so far there's been one individual who has participated in some of the advocacy programs in all of India, and I'm sure there are others and we'd like to work with them. As far as the healthcare system is concerned, we have advocated again for friendly HIV services and friendly, community-friendly, gender-affirming services. So we'll be adding the TB component and hope to have referrals and also follow up clients detected positive until treatment completion. So, the larger picture is that in India, TB is, rather the transgender community data is disaggregated and reported in the national program. However, the TB referrals are done for individuals who have tested positive for HIV. TB screening for key populations who are not tested for HIV or who are HIV negative is not part of the national program, and we're hoping to advocate for that, as well as for greater data use, greater reporting, and trying to maybe do a little bit of fine tuning in terms of community subgroups and looking at their specific vulnerabilities. Our baseline is going to be primarily a qualitative one. So the overall expected results are understanding barriers, both proximate as well as structural and systemic, ensuring communities have access to affirming services, including screening, presumptive TB identification, diagnosis to treatment initiation, developing a pool of community-friendly healthcare providers, streamline data collection and reporting to the national TB MIS, which is NICSHI, and provide recommendations on trans-led TB programming. There's already an excellent gender-responsive framework, and REACH here has been responsible for a lot of the drafting of that. So we are trying to look at that framework from a transgender-specific lens and see how it can be operationalized. Thank you. We're open for questions.
Thank you so much, Ramakrishan. And this is really one of the many very exciting projects under the Challenge Facility, really pushing the boundaries of the TB response and reaching more people and those affected with tuberculosis. Thank you so much for that.
Sure. We also wanted to add one question. If there are groups around in the Asia Pacific region, specifically working with transgender individuals, we'd love to be connected with them. Thank you.
Okay. Thank you so much. Yeah, well, let's take note of that. And if we can recommend organizations for SATI, then we can reach out to them and recommend those organization partners. All right. Last but not the least, from the South Asia session, we have Prakruti. And yes, please go ahead and introduce your group, and then let's proceed with the presentation. Thank you.
Hello.
Yes, go ahead.
Yes, good afternoon, everyone. I am Subraju, Secretary from the Prakruti Social Service Society, Andhra Pradesh, India, Rambachodaram tribal area. Thanking for giving an opportunity as a service partner in Stop TB Partnership Program. Prakruti with literally meaning, established in 2002. Sir, our coverage area in 218,385 tribal population residing in 878 villages of 137 gram panchayats of 7 mandals, small administrative units. our vision is to empower tribal communities to realize their needs and aspirations. Our mission to engage the tribal through a cycle of participatory development, promotion of opportunities, build capacities in assessing, analyzing, and undertaking action towards ameliorating their conditions, especially through optimum utilization of exciting resources and production of natural resources with greater focus on women and children. Our core activities is environmental protection in joint forest management, livelihood promotion and income generation, health and education, promotion of 3+ groups. In the MGNR is a Shram Shakti Sangha, it is the central government scheme, and Godavari flood relief and rehabilitation, awareness rehabilitation of displaced tribal people in Polvaram project. The Polvaram project is the big project in India, and free ambulance service for remote tribal area people. Our key achievements: health and medical emergency support for overall 200 tribal people, remote and hill villages during the year in free ambulance service, and then land ownership documents for 2,850 families from government of Andhra Pradesh, and relief and rehabilitation compensation of displaced people under Polvaram project, and migration labor children in the special schools, migration schools we are conducting, and regular and periodical awareness camps on tribal rights and human rights. And CFCS Stop TV partnership with the population covered tribal men, women and children inhabited in Rampachadaram ITD area, residing in 878 villages of 137 Gram Panchayatis of 7 mandals. And our objectives in CFCS objectives is to support formation of tribal TB groups among affected tribal communities. To federate district level tribal TV groups at the district level advocacy forum and media advocacy with the district level TB officials. Key activities: identification, baseline and line listing of TB survivors and people affected by TB in all tribal sub-districts. Sensitization of TB infected community members, TB and TB rights and human rights. Formation of sub-district level groups. Federation all sub-district level groups as district level. Building TB infected and affected. Awareness meeting on capacity building of federation members and TB rights and human rights. Field visit, monthly review meeting of forum. Interactive and advocacy meeting with the media, interface meetings with the district level TB and the health officials. Our project implementation is exclusively team identified and trained for project activity implementation. Involvement and partnership with the tribal people, TB impacted and affected. Complementing the government lead TB prevention and treatment activities, involvement, coordination and working with the government functionaries. Partnership with the local health infrastructure and media for visibility to TB rights. The project team is the project manager is the 1, Mandal coordinator is the 7. This is the, thank you for all. This is the Prakriti. Thank you. Thanks once again. As a opportunity for the CFCS.
Thank you so much, Prakriti, for walking us through and for giving us what Prakriti will be doing for the following year for the challenge facility. Thank you so much. So let's now open the floor for questions or comments. I see one comment on the chat box from Ramakrishnan saying that Reach's work is very inspiring. So I see a potential partnership in that part as well. Questions, comments, going once, going twice. All right, James made a comment on data and key populations. James, would you like to expand on that? Ah, okay.
Just very quickly, Jeff. I was just going to say, yeah, I think that the SATI project, which looks at the data through NICSHI for key populations, particularly the trans community, is something that is really interesting. Obviously, because of the fact that in India, transgender data is actually collected, and so we actually have an opportunity to understand a lot more of the epidemic in that context. And so I think it will be an interesting one for groups who are working with other key populations in other countries and other contexts to just sort of monitor how that progresses and to see if there's any learnings that they can maybe adapt in their different contexts as well. Thanks, Jeff.
Thank you so much, James. All right. I mute myself. Moving on now to the next session. If you have any other questions or comments, we still have one more Q&A session left after the regional and global. But for now, I'm going to move to the regional one, and I believe it's my presentation from Apcaso. I'm going to turn on my timer just in case for fairness and equality. All right. So from Apcaso's end, so as you can see on the screen, our project under the challenge facility is called Right to Health. Right to Breathe. This is an inspiration from the human rights and TB advocacy toolkit that we developed last year. So we're calling it Right to Breathe mainly because the focus of our grant would be on scaling up the human rights agenda advocacy around the TB response and making sure that people with tuberculosis, TB survivors, and those affected with TB are engaged in the human rights discourse and are able to protect, fulfill, and promote human rights within the TB response. So the ultimate goal of our project is to establish an Asia-Pacific human rights advocacy agenda that will influence national TB responses and align with the regional and global TB agenda for a rights-based TB response. Understanding that there's already a number of documents, including the declaration and also the human rights response technical brief that has been developed by global organizations such as TB People and GCTA. We're gonna utilize those documents and meet it halfway with some of the national level advocacy plans that will be developed to develop a human rights agenda that is appropriate and contextual to the Asia Pacific region. So with regards to the objectives, so definitely you're gonna support civil society and TB affected communities, TB survivor groups. In the rollout of the TB and Human Rights Training Manual, we were able to pilot it in 2 countries, Cambodia and the Philippines. So this will be an opportunity to roll it out and make sure that this will be implemented in a number of countries. Second is to lead the development of a regional human rights advocacy agenda and develop a roadmap, and also advocate with national TB programmers and parliamentarians also to an extent the human rights agenda and the roadmap. So as you can see in the timeline here, so we'll be doing an online regional TB and human rights training of trainers, and we'll be selecting participants from the CFCS grantees. I already noted that some of you will be already doing TB and human rights we will be reaching out to you individually as well to be part of the training of trainers. And after that, we will be supporting 3 countries, Nepal, Vietnam, and Papua New Guinea, because they're not part of the challenge facility for now, making sure that there's already movement there at the country level on TB and human rights. And at the same time, there will be regional consultation, which will be led by Activist Coalition on TB Asia Pacific, to develop the advocacy agenda based on the national advocacy plans that will be developed in the TOT development and also in the country work, and also develop the roadmap as well. And the last part of the grant would be a virtual regional dialogue, which will be an interface between the communities and civil society working on TB, and also the national TB programmers and the parliamentarians as well. So the outcome of that would be that at the national level, there will be an adoption or a commitment from the national governments that the human rights agenda on TB will be adopted into their national TB plans, and to an extent also the upcoming Global Fund grants as well. So I think that's it. I have my time already. If you have any questions or comments with regards to our project, please do so later on when we open the floor, or you can post it in the chat. But definitely we'll be working with most of you for the training of trainers and also for the other aspects of the work. Thank you so much. And then moving on, oh, sorry, before I forget, let me introduce my team. So with me from Apcaso is who's doing the tech from the sidelines. I also have RD on the call as well, our executive director, and also Mangala, program officer, who's also listening in. So yeah, all right. Moving on, we have GCTA, and it will be, Leslie is also part of the ACT-AP steering committee. So if you want to join ACT-AP, you can reach out to us or reach out to Blessy as well so that we can involve you in ACT-AP. But for now, let's listen to GCTA's work. And Blessy, please do introduce your team as well. Thank you.
Thank you very
Go
much.
ahead.
Thank you very much, Jeff. Great opportunity here to share about what we plan to do through the challenge facility. And really, thanks James and Jeff for inviting us to participate in this. Just very briefly, GCTA is all about people affected by TB from around the globe, to bring the lived experience of TB to global platforms, to change that kind of solely medicalized approach and response that we've seen over the years to something that's people-centered and rights-based. And one of the things that GCTA also endeavors to do is to bridge the gap between civil society organizations and communities affected by TB and other stakeholders that are part of the TB response. And of course, communities, especially affected communities, are central to everything in the TB response, and that they're also involved in all the TB processes, including decision making, so that they take the lead and set the agenda for the TB response. Next slide, please. So I'm sorry, my colleague Archana was supposed to present this, but she had to go on to another call. And I have with me our very, very newest colleague who's literally started today, Darren, who will be looking after the communications. He's based in the Philippines right now. And so we're very, very glad to have him on board. And all of you, I'm sure, will be getting to know him and receiving mails from him. So coming to the Challenge Facility grant, this is all about we've all talked about rights-based response, but we wanted to make this a reality, because we felt that, yes, knowing your rights are very important, but then what next? Me knowing my right doesn't help me in any way if there are no mechanisms that support, kind of honoring and respecting those rights. So with that in the background, and based on our last year's experience of having called the first ever meeting of the legal fraternity, the civil society, and the communities affected by TB, to have a brainstorming, looking forward actions sort of a workshop at the union, we felt that it's really important that at the country level, we have mechanisms that support people. First of all, for stakeholders to understand what does a rights-based response for TB actually mean? And secondly, what happens when those rights are violated? So the main objectives are to support the global, regional, and national efforts. Like you've heard, many of the partners in this region are actually looking at that, which is a great thing, because I really think we from this region can lead that. And the second is to strengthen the capacity and build expertise among lawyers, because many times they don't know TB. So it is, in a way, our responsibility to bring that knowledge to them, to help them understand what rights-based TB responses, not from books or not from anyone else, but from the community themselves. And the third one is to provide a supportive mechanism for communities and insufficiently served populations to seek legal support, advice, and depending on what the country feels that mechanism is. And the key activities we've already started, Jeff referred to the Human Rights Policy Brief, which was launched globally recently, and we would also partner with our regional partners for network strengthening and building capacity of the affected communities' work around rights and setting up of legal support. We will be looking at definitely a couple of countries in this region and also in Africa. So thank you very much. That's it from me, and I'm happy to take questions. Thank you.
Thank you so much, Blessy. All right. So next up, we have TB people. So Timur, and Timur will have a presentation. So if you can share the share screen to Timur. So
yes, thank you. I will share the screen in a second. Edit on. And here we go.
After this, we'll open the floor again for Q&A if you have any or comments.
Yes.
Let's listen to Timur now.
So, very briefly about us. We are a global network of people affected by TB. We started in 2016. Actually, we started as a sub-regional network for Eastern Europe and Central Asia, then growing and growing and growing, and eventually getting registered in 2018 as a global network of people affected by TB. Our membership is individual, and currently we just finished a membership review, making sure that we don't keep, the number of people high, but actually we keep only people who are actively engaged. So right now our membership is lower than what it was just a couple of months ago. It's about 300 members from 40 countries. And in addition to that, what we started recently is actually for a couple of years now, it's setting up, creating networks of people affected by TB in countries and setting them up as our chapters. So right now we have 5 chapters and the number is growing. 3 of them are on the way. So our vision is a world free of tuberculosis, which is our shared vision with a WHO NTB strategy, with GCTA and other global stakeholders. Our mission is just 4 words, but quite a lot: unite people and to defeat tuberculosis. Our challenge facility for civil society grants goal is to strengthen the TB affected community and promote the human rights of people affected by TB. And we have 2 major objectives. One is around community mobilization, communication, and coordination. And the second is around operationalizing the Declaration of the Rights of People Affected by TB, which was launched in 2018. Just a second, here we go. So specific activities include mapping of existing networks and initiative groups of people affected by TB globally. We also plan to have a few virtual conferences for community and civil society groups, including one or several similar to this with grantees of the Challenge Facility and other regional and national groups and coalitions. One more activity is specifically around mobilizing community at country level. This is exactly what I mentioned earlier when I brought up my question to Pakistani colleagues. It's basically making sure that we grow community from an initiative group or just a small group of activists to a formal network of people affected by TB, which can be engaged in at the CCM level and as implementers or sub-recipients in Global Fund grants, and otherwise getting engaged in the TB response. We also plan to do some work around strengthening of our external and internal communication. And for that, we're going to have to develop an app which would allow us to communicate better. Right now, the biggest challenge we have in our network is different languages. We have 2 working languages as of now, which is English and Russian. We hope to add 2 more languages this year, But still, the problem is that not everyone speaks those languages. And even if some of our members speak English, others don't. How do they communicate? So we are developing an app which would enable our members to communicate wherever they are, whatever languages they speak. We also hope to work around the promotion of our declaration, and we hope to support the translation of the Declaration of the Rights of People Affected by TB in 10 more languages, including, let me tell you, these are the languages of Eastern Europe and Central Asia, specifically Kazakh, Ukrainian, Georgian, plus we are translating it into Filipino. We are hoping, it is already available in Bahasa. We are hoping to translate it into Hindi and Tamil, I think, is the other language, plus Portuguese, plus Hausa. I can see some bells. I think it's the sign that I need to shut up soon, and a few other languages. But anyway, so we also hope to develop 2 position papers, one on directly observed treatment and human rights, and the other, which we are already developing with the International Network of People Who Use Drugs, is around TB among people who use drugs. They are considered to be a key population, but concrete action is lacking. So with this, I am happily shutting up, and if you have any questions, please go ahead and ask.
Thank you so much, Timur. But please stay for maybe the next 15 minutes if you have any questions or comments.
I'm not leaving anywhere.
Thank you so much. So thank you again, GCTA and TB people, for presenting your grants under the Challenge Facility. We're now opening the floor for questions or comments, if you have any. Okay, Timur?
Yes, that was a smart move, right? So yeah, I just wanted to tell you that basically one thing is that we really hope to work with all the Challenge Facility grantees wherever you are. We are doing the same thing basically, and we have to collaborate. So we are actually, every time we are applying for any funding, we are including some funding that is supposed to go to countries. So this is something we hope to do with Pakistan, but also right now, you guys know that the Global Fund announced the request for proposals, actually a few of them, on TB, on HIV. I think there's also around regional communication platforms and short-term TA. So we are hoping to apply, as TB people, as the global network, but this is a formal invite, maybe, if you will, to the regional and global networks that are present, including ACT-AP, Apcaso, and GCTA, to apply maybe as a consortium. We hope to include a component around strengthening the community in countries and helping them to get formalized, something that is happening now in different parts of the world. But this is something that usually there is simply no funding in the country to support that process. So we see it as a great opportunity to actually do it from the regional or global level, supporting this move in countries. So we do hope to cover some countries of Asia, as well as other regions. We really hope that ACT-AP and Apcaso would be our partners. Even if you guys hope to submit your own application, this is in no way going to stop you from doing that. We just hope that you would be able to also join us in our application, and let's maybe continue this dialogue further. And the same invitation goes to country networks on this call. Let us know if you need this kind of support, so that we specifically mention those countries in our proposal. And this is not for us to get the funding, but rather for us to give you this funding. We are going just to channel it. We're not going to keep it for ourselves. So this is the idea. And thank you once again for organizing this webinar. I think it's a perfect opportunity to have this dialogue. Thank you.
Thank you so much, Timur. And I will use that opportunity to move to our next part which is the last part of our webinar this afternoon. So having heard the different grants from the different organizations in different countries, we already saw some initial partnership and potential collaboration from different partners. How do we as a collective want this to move forward? Timur already mentioned something around the RFP, but as challenge facility grantees, how do we want to continue this communication, this interaction of different grantees, this partnership moving? Any suggestions or any thoughts on this? Definitely from Apcaso's side, we already started creating a website on our challenge facility as Asia Pacific, but we will allocate a portion of that website. You can see that website here. I'm just posting it here. A CFCS webpage wherein you can send us your different resources, any materials or any blogs, any posts that you would like to promote. And you can use our website as an opportunity, and also our Facebook page as well, to blast any promotion or any document that you'd like to share. Even if it's a country level document or reference, that would be really amazing to share from a regional and global level, so that we can disseminate this really helpful outputs that we will be developing under the CFCS grant. So please do visit our website. It's still under construction, but once it's out, we're gonna share the final link to you. And also, please do subscribe to our newsletter. Apcaso being the Asia Pacific Communication and Coordination Platform of the Global Fund for Asia Pacific. We have a newsletter as well, and we will be using the same newsletter to promote challenge facility grants and activities as well. So please make use of that as well. Okay, so any thoughts from the partners, or if you would like to promote any ways in which you would be sharing your information and updates from your grants, you may use this platform as well, or we can hear from Stop TV Partnership for any ideas. We'll be creating any listservs or groups. I see Timur's hand up, and then RD. So maybe Timur and then RD.
Yep. Actually, we were going to start a mailing list. Just wanted to make sure that we're not doing it at the same time as someone else from the challenge facility grantees is doing. It's basically an idea to set up a Google group that would not be owned by any one of the grantees, but rather would unite all the grantees. We just need to know who would be the focal points from each of the grantees, so that we put together. And then it will probably just not belong, as I said, it will not belong to any one organization, but be used to share information, to coordinate better. So this is the idea. We were planning to do this. So unless anyone wants to do this, then we will be happy to initiate that process. And one thing we will need to know is the email addresses and names of people who would need to be included. Thank you.
That's a really wonderful idea, Timur. Thank you so much for raising that. May I call on maybe James first and then RD last, being the Executive Director of Apcaso, and also to do the closing, RD, if you don't mind. So James? James, you're on mute.
Oh, I'm muted. I'm still coming to terms with this these webinars. Just to say, I guess, like to say a couple of good comments. Like firstly, to you, Jeff, and to the team at Apcaso and to Chamrun and ACT AP more generally, thanks so much for the leadership in this. I think it was a really rich discussion. It was even like for me, and I was chatting with Kiva on the side. I think for both of us who know all of these grants quite well, it was still kind of it was really fascinating to kind of see the richness of and the diversity and I guess the high caliber of all the grantees here. So thanks to everyone, and I hope it was a valuable discussion. I think just to come back a little bit to some of the discussions at the start, I think all the work that you're doing, what we would hope that you would think about it as not just a single project, but as part of a movement, as part of contributing to sort of broader change, where I think one of the ACT Asia Pacific goals is to sort of provide an alternative to a prevailing biomedical approach to TB. And this is very much what all of these projects, every single one here, whether they're about community-led monitoring, about key populations, about human rights advocacy agendas, all of them are about doing exactly that. And so I think I would just encourage you to be thinking as you're going over I know everyone's busy and gets caught up in the day-to-day work, but to think a little bit about, is this something that I could share at the regional level? Is this something I could share at the global level? Because some of the learnings and some of the things that we have done might be valuable, and there's opportunities to sort of, not only for me to share, but maybe for me to learn from others. I heard, for example, lots of people talking about community-led monitoring initiatives that they're doing, lots of people talking about mobilizing communities. Maybe there's some things there, some lessons where we can all draw and learn from each other to really strengthen this broader sort of CRG agenda. So again, thanks very much to all the partners, and I really appreciate everyone's time. I know how busy you all are, but I think I hope you found it a rewarding discussion. So back to you, Jeff and RD. Thank you.
Thanks, James. Sorry, RD, maybe before going to you, Kiva sent me a message. So Kiva, very quickly to you, and then RD last.
Great, thank you,
Sorry,
Jeff.
RD.
Thank you, sorry, RD. And just really, really quickly. So we in StopTB have this ongoing sort of challenge when it comes to M&E of CRG work. And this is something that as a team, we've been going back and forth on and on and on and on. So what we will be doing is sending out these technical templates for you where you can report on progress updates, but also a self-evaluation of the work that you're doing. And for me, I think this is really important because we don't have a formal mechanism to monitor and evaluate your work like TB Reach projects, for example. And I'm just wondering, and James and I are having these discussions about, how do we make this information relevant and useful to us for civil society? I'd like to promote work as well as to report back to our donors and. So I'm just wondering whether we could at some point leverage, Apcaso and ACHIE to support the communication of these results, because right now we've seen projects really nicely outlined, like your objectives, your vision, your aims. Now, how can we make sure that we are monitoring and evaluating it in a way that is simple but is effective, and we can communicate those results? So I'm just wondering whether at some point we can continue this conversation to see how we can leverage Apcaso and ACHIE to share these results. Thank you.
Thank you so much, Kiva. And that reminds me of the webinar that the StopTB Partnership did last week on communications. Communications and making sure that we promote our work to the outside world, if you can say that, is one thing, but making sure that these different partnerships are happening and the collaborations are pretty much showcased as well under the Challenge Facility umbrella would be another thing as well. So maybe that's something the StopTB Partnership can really think about. And with that, unless there are any others who would like to raise something, I'm going to give now the closing to my Executive Director, RD. So going once, going twice. Okay, RD, it's your turn. And
Thanks,
please
Jeff.
close the webinar. Thank you.
Thanks, Jeff, and thanks everyone. First off, really thank you, sincere thanks and kudos to StopTB Partnership for having mobilized resources for this amazing round of CFCS. As I was listening to each of the presentations, I'm just blown away by how far I see that the movement is moving, and that's in big part to, of course, all the work that are happening at the country level, plus the regional movements and global movements, plus also efforts from the StopTB Partnership to do allocate funding for community and civil society efforts. So that just has to be said. A few years back, we kept on harping about earmark funding for civil society. We have it, and that's really, really nice to see. In terms of moving forward, I think this is also building upon the points of Kiva just now, with the long-term vision of making sure that the TB agenda isn't hijacked by new favorites or new developments or new like issues that might run TB funding in danger of getting displaced or replaced. It would indeed be good to have at this early point some thinking, and this is something that Apcaso and Asia Pacific will be happy to have continued conversation with StopTB in terms of from the outset developing something for, because what I'm seeing, it's beautiful to see individual country objectives and activities and documentation, but what we're trying to say here is that the whole of us together, learning from each other, the different activities, the regional activities, the global activities are more than the sum of the individual parts. And if we have come to an agreement to dedicate time and resources and energy to actually capture in documentation in a systematic way, in a way that is systematic but wouldn't hinder the actual activities, that would be good. So we have some basis of saying this is what we're trying to do, these are the needs, and to have basis for continuation of funding, hopefully. Thirdly, I really do appreciate opportunities like this where we as actors, colleagues, comrades from the same region are getting the space to talk with each other, know of each other's work. To me, even the timing of the call, which is Asia Pacific friendly, is fantastic because I'm so tired of having to stay up until 9, 10 in the evening to join global calls. And it's good that we build, like while we welcome global colleagues invitation, I do see the value and the need to maintain safe spaces for regional discussions, for regional spaces, and for regional strategizing, for solidarity, for sharing lessons. Some people know each other already, and there's a lot of value in that. And there's also great to have come to know new partners. I hope that everybody, unless you say otherwise, are happy as Jeff has opened the membership to ACT Asia Pacific to join. I think we'll take that as a yes, unless people would say, no, we don't want to. But I really look forward to ACT Asia Pacific being the platform for us to push for us vibrant TB activist movement in the region. Lastly, related to monitoring and evaluation, we have to think about that now, and also documentation. But related to the website, within the Apcaso website, Jeff, that you mentioned, is I would actually hope that everybody would feel that the resources that they will develop from their own organizations, they would be happy to share as resources for the region. We don't have to keep on, for the grantees, as well as future people or networks in some other countries which might do similar work. So maybe it would be good for Apcaso/ACT Asia Pacific to also act as database for groups to actually contribute outputs and tools that they'll be developing out of their CFCS project, as well as the CFCS profiles in collaboration with Stop TB Partnership. So with all that, again, from Apcaso, we're very, very happy to be part of this. Aside from, of course, our project in partnership with ACT Asia Pacific has components of country work and also regional coordination. But beyond that, the commitment to see a more vibrant, non-biomedical approach to the TB responses in the region. We welcome this opportunity, we welcome the resources, and we look forward to working with all of you and to learning from each of us together. And we are also, tomorrow, the steering committee of ACT Asia Pacific would actually meet to talk about the request for proposals submission that we will be lodging to the Global Fund around TB. We would definitely connect that to all existing initiatives in our region and the global ones that have components of Asia Pacific. We would take into consideration our role as the platform, as Apcaso, as well as the CFCS grants. And then most likely would reach out again to people when we have a more solid basis for the objectives of that grant. But also, hopefully that we will have additional resources for countries in the region through that. With that, thanks everyone again, and thanks, Jeff.
Thank you so much, RD. So with that, maybe just one request before you go. Can I all request everybody to turn on their videos?
I was about to ask for that. Yes.
Let's do a quick photo ops. Too bad we lost the others already, but maybe just this is the new normal, I guess, for the.
I actually wanted to request that. I forgot. Yep.
So maybe just a quick one before everybody goes. But do let us know if you're not comfortable with posting this on our social media platforms. And we'll
RD, are you really there, or is that a background picture?
I could pretend that it's a Zoom background, but
Let's
I'm
wait
actually.
for others.
I missed my screen time.
How about the others? Oh, okay. So I guess the others are fine. Okay, going once, going twice. 1, 2.
My camera is error. I think that's Chanton.
Say NTB 1, 2, 3. NTB. One more. Stop TB 1, 2, 3. Stop TB. All right. And with that, thank you so much, everybody, for joining and for staying the last 2 hours. It was a really nice conversation. And I hope to see everybody soon. Let's continue the conversations online. Bye for now.
Thanks, everyone. Thanks,
Thanks
Jeff.
a million. Bye, bye, bye.
Thanks,
Thank you, guys. Thank you. Bye.
Thank
Thanks,
you. Bye-bye.
everyone. Bye.